This will be a quick neuromuscular medication review. To study for the exam, it does help to place the information side by side to view the differences. Fingolimod is an oral medication, and it prevents the T cells, the immune cells, from getting out of the lymph nodes. It's like the Roach Motel model of immunity. They can check in, but they can't check out. T cells cannot get out of the lymph nodes and go into the blood, and if they can't get into the blood, then they can't get into the nervous system. With this medication, you need to watch for liver enzymes, lowering white blood count, and decrease heart rate. Teriflunomide basically decreases production of T cells and B cells, which are also immune system cells. You need to look out for white blood cell counts, liver functions, and infections. Gladiatiromir, this drug helps prevent the body's immune system from attacking nerve fibers. Mitoxantrone, this drug slows disability and reduces the relapse rate. Natalizumab, this MS drug reduces the relapse rate, which has had some controversy due to potential for fatal brain infection called leukoencephalopathy. Levodopa is the most powerful drug treatment of Parkinson's symptoms and is chemically found in plants and animals. Nerve cells can use levodopa to make dopamine, which replenishes the low amount in the brain. Levodopa is often used in combination with carbidopa to prevent or diminish some of the side effects of the medication. There are some concerns about the long-term effects of levodopa, especially the development of involuntary movements like dyskinesia that can be disabling. Dopamine agonists are drugs that mimic the role of dopamine in the brain and work by stimulating certain parts of the brain and nervous system. They can also be used in combination with levodopa, but are generally less effective in controlling rigidity and bradykinesia. MAO-B inhibitors slow the breakdown of dopamine in the brain. They also may prevent the removal of dopamine between nerve endings and enhance release of dopamine from nerve cells. Catechol or methyltransferase inhibitors work by blocking an enzyme that breaks down levodopa and dopamine. Alone, the meds aren't as helpful, but they work well in combination with levodopa. Talcopone and entacapone, they slow the body's ability to get rid of levodopa, so it lasts longer and is more consistent. When talcopone is used, frequent blood monitoring for liver damage is needed. Because they increase the effectiveness of levodopa, both talcopone and entacapone may also increase its side effects, such as involuntary movements. Anticholinergics are sometimes given in the early stages of the disease to help treat symptoms such as tremors. They block signals of the neurotransmitter acetylcholine. This becomes overactive because the disease causes a degeneration of another neurotransmitter, dopamine. The drugs can help restore the balance with dopamine, and they are not generally used in patients over 70 because they can exacerbate confusion and memory problems. Anticholinergics are sometimes used with other Parkinson's drugs like levodopa to help increase their effectiveness. Glutamate. Meds like Lateral are used to treat stiffness and shaking caused by medicines used to treat nervous, mental, and emotional conditions. By improving muscle control and reducing stiffness, this medication allows more normal movements of the body as the disease symptoms are reduced. Medications used to treat the disorder include anticholinesterase agents such as neostigmine and pyridostigmine, which help improve neuromuscular transmission and increase muscle strength. Immunosuppressant drugs such as prednisone, cyclosporin, and azathioprine may also be used. These medications help improve muscle strength by suppressing the production of abnormal antibodies. They must be used with careful medical follow-up because they can cause some major side effects. Now remember that myasthenia crisis is due to undermedication, whereas cholinergic crisis is due to overmedication. Tensilon testing within 30 to 60 seconds after injection. Most myasthenic patients show marked improvement in muscle tone that lasts 4 to 5 minutes. Atropine sulfate is the antidote for tensilon complications. Cholinesterase inhibitors, drugs such as pyridostigmine, enhance communication between nerves and muscles. They don't cure the underlying problem, but they do help improve muscle contraction and muscle strength. Corticosteroids inhibit the immune system, limiting antibody production. Prolonged use of corticosteroids can lead to serious side effects like bone thinning, diabetes, weight gain, increased risk of some infections, and an increase in redistribution of body fat. Immunosuppressants may be prescribed that alter the immune system. ALS. As yet, there is no cure for ALS, and treatments are designed to relieve the symptoms and improve the quality of life for people with the disorder. Medications can help reduce fatigue, ease muscle cramps, and lessen pain. There is also a specific medication for ALS called riluzole. It does not repair the damage already done to the body, but it appears to be modestly effective in prolonging the survival of people with ALS. The drug appears to slow the disease progression in some people, perhaps by reducing the levels of glutamate, which is a chemical messenger in the brain. Riluzole is also very expensive. Even with Medicare, it can cost anywhere from $1,000 to $2,000 a month. The medication requires monitoring of liver function, blood count, chemistries, and alkaline phosphatases. The side effects include increased weakness, sedation, and dizziness. Non-steroidals such as ibuprofen or naproxen may relieve general discomfort. Due to potentially severe gastrointestinal and cardiovascular side effects, non-steroidals should only be used as instructed. Tramadol is most often prescribed for pain relief. Medications can also be given to help control symptoms of muscle cramps, spasms, constipation, fatigue, excessive salivation, pain, and depression. Huntington's disease. There is no satisfactory treatment that is available to stop or reverse Huntington's disease. Some approaches can control signs and symptoms, but eventually it causes physical and mental disability. As the disease progresses, long-term nursing home care may be necessary. To treat the abnormal movements, the chorea, caused by Huntington's disease, the physician may prescribe antipsychotic drugs such as Abilify or risperidone. They may also get Haldol for hallucinations and antidepressants or mood stabilizers such as Prozac, Zoloft, or lithium to even out the mood swings. Tetrabenazine is the first medication to be specifically approved by the Food and Drug Administration for the treatment of the signs and symptoms of Huntington's. It helps reduce the jerky, involuntary movements of Huntington's disease by increasing the amount of dopamine available in the brain. Possible side effects include insomnia, drowsiness, nausea, and restlessness. This medication isn't recommended for use in anyone with depression, especially if they have suicidal thoughts. Clonazepam and antipsychotic drugs can help control movement, violent outbursts, and hallucinations. While these medications are helpful, a common side effect is sedation, and in some cases they may cause additional stiffness and rigidity. Medications like fluoxetine, sertraline, and nortriptyline can help control depression and obsessive-compulsive rituals that some people with Huntington's disease develop. Medications like lithium can help control extreme emotions and mood swings. Side effects from many of the drugs used to treat the symptoms of Huntington's may include hyperexcitability, fatigue, and restlessness. Alzheimer's medications. Cholinesterase inhibitors are used to treat mild and moderate dementia. They block cholinesterase, which is an enzyme responsible for breaking down acetylcholine. Cholinesterase inhibitors improve or stabilize cognitive decline, but do not cure or reverse. Aricept improves some function of the nerve cells in the brain and is used to treat mild to moderate Alzheimer's dementia. An Exelon patch is used to treat mild to moderate Alzheimer's, but once it's been opened, it must be used as soon as possible, as it starts to lose its effectiveness as soon as air hits it, and it is applied once a day. Remenil, which comes from the bulb of a daffodil, is used for mild to moderate Alzheimer's. This medication is available in extended release form. Cognex, which is used for mild to moderate, is 4 times a day on an empty stomach. Namenda has been around since 1968 and is for moderate to severe Alzheimer's. It does come in liquid or those having trouble swallowing pills, and it does slow the rate of decline. Treatment with a cholinesterase inhibitor may reduce the burden on caregivers by producing small improvements in memory and general ability to function. Medications for Alzheimer's do not work for everyone who takes them, and their effectiveness is not always dramatic. Even if they do initially reduce the symptoms, the medications eventually will no longer control the progressive symptoms of memory problems, behavioral and personality changes, and thinking problems caused by Alzheimer's disease. Medications can relieve the symptoms and temporarily improve physical and mental health. While medications may reduce the severity of Alzheimer's symptoms, thinking and memory problems, and personality changes, it will not completely eliminate the symptoms, nor will they prevent the disease from progressing.